All you have to do is I'll send a link to a Google form at the end of tonight, and you just kind of put your name and how you heard about us, and we'll email you a Word doc, and you just have to insert your name. Aside from that, if you want to go check out any of our other shadowing events that we've done, or if you missed something during today's presentation, we have a YouTube channel where most of our shadowing sessions are up on, so feel free to check that out. And I think that's all I have, so I'll hand it over to you.
What's up, guys? I'm very honored to be joining you and talking to you guys today. I don't have a presentation other than just me talking. So, like I said, I'm actually in Atlanta right now. Me and my wife, we're stuck in a hotel room. I'm doing some Botox and derma filler training tomorrow. And so I apologize for that, but it's awesome to see y'all from all over the place. And I say y'all because I'm from Alabama and Georgia. So, um, so a little bit about me and how I became a PA. So my whole family was involved in medicine. My mom was a nurse for 25 years. My father worked in a hospital, taught first aid, CPR, new employer orientation, all that stuff. So I grew up in a hospital, grew up around medicine, knew I wanted to do that. Went to college, luckily, on a baseball scholarship. Was fortunate enough after my junior year to get drafted by the Astros. And I spent the next almost 10 years playing or coaching minor league baseball. Um, and so, which was an experience I would never trade. And actually, I think it helps me in medicine. Um, I got to interact with many different types of people from different countries, spoke different languages, many different socioeconomic backgrounds that helps me now when dealing with patients. So, aside from just um, the athletic standpoint, and if you play athletics, you know how much that would teach you as far as just some life skills in general. But that part of my life has really helped me in practice, and it's also um, it helped me in my process of getting into PA school. Um, a lot of programs want to see obviously your academics, and everybody that's applying to PA school mostly is going to have the academics, but they want to see other things as well. They want to see your shadowing, which is why this is awesome, especially during the whole COVID thing that's going on. They want to see you volunteer. They want to see, what life experiences you have, what healthcare experiences you've had, and et cetera. So kind of fast forward about 10 years from that, I quit playing. I'm like 28, 29, and I go back to finish my undergrad degree. And so I'm like 28, 29 on campus. I was living between Birmingham, Columbus, Georgia, and I was going to school in Montgomery. And so I would literally stay on campus at like 29 years old in an apartment with some undergrad students and finish my degree. Um, but I got it. And then after that, I actually went and coached another year in pro ball. And then I kind of like walked away from baseball. It was time. I was ready to move on with life. Went through a few more life changes and kind of decided that I wanted to go back on the path of going to med school or PT school, actually. So PA wasn't really on my radar to begin with. When I went to undergrad to begin with, I wanted to go to med school or PT school. I didn't know what. And I hadn't even heard of PA school really. And even when I decided to go back into medicine and try to go to school, I didn't know that much about PAs. Luckily, we had some family friends that were PAs, and I was able to talk with them about the profession. And I fell in love with it right away. I wanted to go to med school, but I didn't want to spend 4 more years because I'm already an old dude. So I didn't want to spend 4 more years in med school and then go through a residency and fellowships and all that. Um, and I didn't want to be tied into one thing. which is awesome because I do many things right now. And I think that's like one of the greatest things about the PA profession is that the laterality that we have is just awesome. So if you get tired in doing something, burn out in it, get into something and find out it's not what you really thought it was, you can switch and go do something else, which was a huge, huge plus for me. So I went back to school for a third time because, like I said, I was old. All my anatomies and all my chemistries were over 10 years old. And a lot of schools don't want them that old. So I had to retake for another year and a half, 2 years, undergrad courses just to apply again. In the meantime, I started working as a PT tech and a medical assistant just to get my hours. I was volunteering at places, any place that I could. Luckily, I had the connections with my parents, and it wasn't that hard to do. But one thing I will say, when it comes to shadowing, when it comes to applying to school, when it comes to anything along those lines, don't take no for an answer. I would not just email places or call them. I would show up at their office. I would show up at the hospital. I would go to the HR people. I would go to the office managers and say, can I shadow your PA? Can I volunteer here? I would go to the schools I was applying for, not just go to the information sessions. I would try to call them and go see them one-on-one because a face in front of you is a lot different than an email or just some letters through an email, or even just a phone call, a voice on the phone. You see, if you take the time to actually come in and see them face to face, they put the face with the name. They remember that you took the time to come in. They see that you're serious about it. Not many people are willing to do that. And sometimes it takes that. Like I said, they want more than just grades. They want to see that you're serious about PA school, and that it's what you want to do. On the flip side of that, it benefits you because you need to make sure that this is a career that you want to do as well. A lot of times some things can sound good until you get in and you actually see what the different specialties do. Until you actually see blood drawn or poo on the floor or, just whatever it is. And you might rethink, maybe this isn't for me, or just dealing with people. Okay. I mean, in the healthcare profession, it's what we do. You deal with people day in and day out, different types of people. And you have to learn how to approach people differently. Okay. Not, and this is kind of where I think some coaching helped me too. Okay. You can approach a patient one way and get a good result from them. Another patient may not respond to that same approach, and you have to be able to notice that and kind of work around that. Okay, so after all that, I finally finished. I started applying to schools. I interviewed my first year, didn't get in. My next year, I kind of moved cross country and I only applied to one school, and I wasn't really expecting to get in because it's one of those that accepts like 90% of in-state people, and I had just moved in-state. My third year, I applied to all kind of the same schools again. And actually, I was living in South Dakota at the time and wanted to kind of get back closer to my family in Alabama. And so we were down, my wife and I were down over Thanksgiving, and I was just kind of looking through schools and kind of noticed one I missed, which was Mississippi College, which is where I went to school, over right outside of Jackson, Mississippi and Clinton. And kind of, there was really only like a month left to apply. And I just thought, why not? But I did read through, their mission statements, and I advise everyone to do that. Read through the mission statements, know what the schools are looking for, know what they want. And it kind of fit. It's a Christian school. My undergrad was a Christian school, which fits with, my beliefs. They were a small class, only 30. And they literally say just what I said, we look at grades, but we're also looking for, well-rounded people, life experiences, some other things going on. I was fortunate enough to get accepted, and loved it. We had an amazing class. Our class rocks, 100% pass rate, some smart people. And most everybody's out working and killing it right now. And so then after I graduated, with about probably 3 or 4 months left in school, I was offered a job in psychiatry. It had been kind of on my radar, but I was more leaning towards like family medicine, internal medicine, or the ER. But we're in the middle of COVID. I got offered a really good job coming out of school, so I was like, I'm taking it, and I love it. I love it. I love it because I get to see people get better. And it sounds crazy, but like, one second. If somebody has hypertension, I can watch their numbers come down if I give them the medicines, right? But not necessarily watch them physically get better. Sometimes people, and I don't deal with just people with mental illness, I deal with people that have addiction. I deal with homeless people, which is another reason I love what I do, because I really feel like I'm helping the least of us. But I can see these people get better, like quick. So if they come in withdrawing, I can help them. You can see them get better quick. Homeless people, all the time, I can help place them someplace that hopefully helps them in their life and get off of that. Depressed people, if they're off their meds for a while, come in. Psychosis, I can physically see them get better, which is awesome to me. And aside from that, I also do some work at a clinic, and they're actually, I'm going to start doing some aesthetics for them, which is why we're in Atlanta, like I mentioned. I see personal injury patients. I do medical clearances on them and evaluations. I also do some family medicine type stuff for them, and acute care, like how I've drained some abscesses for them. Somebody came in with a ganglion cyst yesterday. I said, I'm not touching it. Go see a hand doctor. Just some stuff like that. And I just signed on to start at a new acute care as well. I loved the ER when I was in it, loved it. And I was going to work there, but they didn't have an opening until this summer. And I got bills now. So, but luckily I'm able to start at this acute care and then maybe work my way back into the ER some. But these other two, it's really good because they're 2 PRN gigs, and I kind of make my own schedule when I can come and when I can't, when I want to, which is awesome. I'm totally blessed with, especially during the era that we have right now, to be doing what I'm able to do right now. So yeah, that's a little bit about me. Anybody have any questions, let me know. I'm gonna try to answer and help you guys in any way that I can. I was a non-traditional student. I went through, worked my tail off for about 5 years before I could actually apply. And it's been another 2.5. Our program was 2.5 years in school. So, I have a little bit of a different route to PA school, which is fine. That's another thing I'll tell you guys, especially if you're younger. You don't get on the first try. If you don't get on the second try, keep trying. If you keep beating the doors down and keep showing schools that this is what you want to do, keep building shadowing hours, keep getting patient care hours, keep volunteering, keep going and putting your face in front of them, you will get in, I promise. I promise. If you're taking time to do stuff like this, I'm not even going to worry about the grades because I know you're there. Strategies with choosing schools. I chose ones that wanted to let me in. And I tell people that I was not a person, that said, I'm only going to go to Emory or I'm only going to go to UAB. And I just say those because those are the big ones down here in this hell. And if I can't go to those, then I'm not going to go. That wasn't me. I wanted to go to whatever school fits what I thought fit me. And Mississippi College was that. So it was a Christian school, small class size. I came out with the same degree and I have 3 jobs now. So it might matter. It's kind of like law school. It doesn't really matter unless maybe sometimes you're trying to go work at a very big hospital in a very narrow field. But I just wanted to get in and go to PA school and come out and be a PA. And as long as the school kind of fit where I was academically and where I was, with patient care hours and that type of stuff, I was all about it. So when you reapplied it. Okay, so about the personal statement, I did not change it a whole lot other than adding in what I had done from the time that I applied before, so within that year. I didn't change it, the bulk of it. I mostly just kind of added to it to show what I had done from the time that I applied last until now. More shadowing hours, more patient care hours. If I took another class, I would add that in. But their personal statement, and I tell people this all the time too, your personal statement is truly, it is about you. They don't want some pre-planned, cookie cutter, I'm going to write what I think you want to hear statements, okay? They want to know if you're a good fit for their school, if you've actually taken the time to go read their mission statement and see, are they a primary care based school? Are they a surgery based type PA school? They want to know if you've done your homework on them as well. But then they want to know about you. They want to know your life experiences. They've got the grades on the paper. They know that. Okay, so you can talk about that a little, but they already know that. They know what you are academically. They want to know who you are as a person. Yes, I think I just answered that. Yes. Yep. So all you can do is, if you don't get in, and you can go talk to schools, they will tell you, after you've applied and you're not accepted, you can talk to them, and most of them will tell you, either, well, your GPA is probably just a little too low for us, or GPA is fine, but we want to see more patient care hours. If they want 2,000, 3,000, and if you only got 1,000, just go to work some more, volunteer some more, just up your credentials. That's all you have to do. How many hours a week do you work as APO? Oh, I don't even know. So I'm Monday through Thursday, full-time at Psych. I will leave there at 5 and go see patients at the other clinic till about 6 or 6:30 some nights. So I'll do that probably 2-3 times a week. I will be there all day on Fridays, about 2 times a week. And then I'm about to start at least 2 weekends a month, either Friday, Saturday, Sunday, or Saturday or Sundays. So I'm looking at 3 days off a month right now, but that's because I choose to do that, right? That's why I said I'm very fortunate that my other PRN jobs are I can schedule them as I want to, which is really awesome, and I'm really blessed to do that. But I know, if you're in a surgery subspecialty, you're going to work a lot. You'll get compensated well, but you're going to work a lot. You're going to be on call. You're going to do surgeries early in the morning. You're going to be clinic till late at night. So I mean, it's just, you have to find what you like. And that's another thing. A lot of you may have a clue, like think you have a clue about what you want to do. And that's great. And you may get into PA school and may go do that and love it. But keep an open mind once you get in. If you're already in, I don't know where all y'all are right now, but if you get in, keep an open mind. Don't say you're not going to do anything or don't want to do anything on your clinical rotations, or go in with a preconceived notion that this is not what I want to do. I can't tell you how many people from our class, from a class above us, from other schools that I've talked to, other PAs that I've talked to, thought they were going to absolutely hate something, and they're working in it now because they fell in love with it. And even if you don't fall in love with it, you're going to learn something from that rotation that's going to help you in your career somehow. Okay. So if you don't want to do surgery, cool. At least maybe learn how to suture a little bit. But you're going to know how the surgery setting works. And so if you're a hospitalist, or, you know, even if you're, whatever it is, if you're a family medicine person, you get a person that just came off of surgery, you're going to have an idea of how that works and how that went down. You've got your career choice. Never. But I knew that's what I wanted to do. I knew I wanted to do medicine. I wanted to help people. I couldn't see myself doing another job where I am not making a benefit somehow. I will say that we did have a person in our class that made it all the way through didactic, and after about 1 or 2 weeks in clinicals, they said, this isn't for me, and they left PA school. Super smart person too. And she's went on doing something else, and she's loving it, and great. That's awesome. But schools don't really want that to happen. Seats are limited, right? And they want to give it to people that truly want to be there. So that's why I say, make sure before you apply, before you get in, that you know that this is what you want to do. It's very competitive. I mean, some say it's even more competitive than med school. I don't know, maybe, but it is competitive. And they want to make sure that, you know, this is what you want to do. And they're also concerned, you know, rightfully so, about their pass rates, which I get. They don't want to be putting out people that are not passing it. If you're able to get in, you shouldn't have to worry about the pants. If you put the work in school, you'll be fine. What day might look for you? Okay, yeah. So, like I said, Monday through Thursday, I'm working in psychiatry. So I do inpatient and I do outpatient. So I will get to work on, and I have a nurse practitioner that covers for me Friday, Saturday, and Sunday. So I'll get to work on Monday, and I'll see obviously what's came in over the weekend and what I have on my inpatient list, and if there's anybody that's still there from before. And that could be anywhere from as few as 3 or 4 patients to 10 patients on an inpatient day. Just depends on the discharges and admits. And so I'll do rounds on my inpatient. Where I work is there aren't many long-term psych places anymore inpatient. Mine is more of a short-term. Average stay is like 3 to 7 days. We have like 3 different units for inpatient, and I see patients from all of them. So I'll see them, see my new admits, you know, reconcile their medications, see what they need, just take care of the inpatient people. And then I'll start my outpatient practice in the afternoon. So from 1 to 5, I'm seeing patients either still telemedicine, or some of them are starting to trickle back in now, and I'll see some in office. And I do that, like I said, Monday through Thursday. And then Fridays, Saturdays, and Sundays are kind of how I want, well, and then I'll leave there at least probably 3 days a week and go over to my other clinic and see patients over there from 5 to 6, 6:30, something like that, for an hour, hour and a half, sometimes 2 hours. They stay open a little bit later. And then, like I said, Friday, Saturday, Sunday, I'm fortunate that I can kind of schedule as I want. I'll either go back to the clinic that I go to after hours and see patients on a Friday for a full day. Or now I'm about to start on the weekends, at least twice a month, going to acute care, which, I mean, you guys are familiar with acute care. It's, you know, it's going to be some family medicine and acute care because, you know, patients like to treat the ER and acute care like a family medicine clinic. That's just kind of the state of our healthcare system right now. So it is what it is, but I enjoy it. So, and, you know, a lot of times PAs in the ER, I was fortunate when I was doing my clinical rotations, I did my elective, I did my regular ER rotation, I did my elective in the ER, and then I spent, our program has a clerkship. And so the last 3 months we get to pick whatever we want and spend it in that. And so I spent half of that in the ER too. And the good thing about the ER that I was training at is they treat their advanced practice providers just like the physicians. So anything that came through that door, we can handle, or they handle, unless it's super, super complicated. A lot of ERs will not let your mid-levels. I know that's like a big thing to say mid-level. I don't care if you call me mid-level. I'm sorry if that offends anyone, but don't let their mid-levels handle that type of stuff. They're basically in an ER in an acute care, like fast track type setting. So that was really cool that I got to, you know, see and kind of do or assist in some of the big procedures, you know, that a lot of times they don't let. So I do not, that's another great thing about my job. I'm very independent. I have a supervising physician and we talk, and I basically will go to him if I have a question. Other than that, I don't report to him really at all. I send my notes for him to sign off on. He actually calls me and asks me to see patients for him and stuff like that. But it is not something that I don't talk to him. I was just telling my wife the other day, I was like, don't think I've talked to Dr. Hudson in like over a week. So unfortunately, yeah, I show up and I do my work. I see my patients. Nobody's standing over my shoulder. If I have any questions or something that's tough, I can call him right up. He'll answer. But other than that, I'm doing my own thing basically. And I'm definitely doing my own thing at the other clinic. There's no supervising physician on site there. He's actually up here in Atlanta most of the time. And so I am the provider when I go to my other clinic as well. And I will be the same at the acute care. It will be me and maybe 2 medical assistants. The other physician will be there on occasion, but there'll be a lot of times that it is just me and the 2 MAs. So every job that I have right now, I have a ton of independence in, which I really like. It can get sometimes a little airy, but you figure stuff out. And any of them I can call, they'll answer right away, or text and they'll call me right back. So that's a good question. I actually enjoy both. If it's the first time seeing them, I like to see them in person, but I really don't mind telemedicine. I don't like the technology because sometimes, like, I'm talking with people, they're using their cell phones and they're talking to me like this, and you know, the connection's bad sometimes. So aside from that, that's the bad part of it. But it actually sometimes is a lot easier because people can, you'll find that if people have to like actually get up and come to you'll find some people really prefer to come in, which I'm fine with, but some are really hard to get in. They'll cancel for any little thing. But if I can see them, at least make sure they're doing okay. And if there's any kind of medicine tweaks or anything that I need to make, if they can't make it in, at least I can see them and talk to them for a minute. And sometimes I even have to call them on the phone because the connection's so bad. But if I can at least just see them and talk to them and just see how they're doing and see if there's anything I need to do for them, I would much rather do that than just not coming in. So I like them both, either way. Cool. Mm-hmm. Anything else? Keep them coming. So is everyone still trying to get into PA school mostly, or get into some sort of medical field, I would assume? Good, good, good. Awesome. Awesome, awesome. Come with, we need PAs. Number one, not only the number one medical job, it's number one job now. It was like number one medical job, like number three now. It's number one job in the country. So keep on, we need them. Does anybody have a clue what they want to do? Anybody want to do something like crazy fun, like neurosurgery or something? ER and orthopedic, nice. ER, nice, nice. Good. Ortho, yeah. See, everybody thought that everybody I talked to, you know, I was a former professional athlete. My wife and I are both actually now professional fitness competitors as well. And everybody's like, "Oh, I bet you do ortho, huh? Because you play ball." I'm like, "No, that's not for me. Like, I'm big, I'm goofy, I sweat a lot, I'm clumsy. Like, the OR is not my place, not for me." I can handle suturing people, doing some INDs, some stuff like that, but being wrapped up in those gowns, it's not for me. Proceed. Ooh, do your thing then. I like that.
Going off what you said about both being professional fitness competitors, there was a question earlier asking how you balance like all of your work hours and your like family life. How do you make time for everything?
Yeah. Well, one big thing is we don't have children yet, so that helps. It's in the talks. I don't know if it's at. We're kind of iffy still, so that helps. But my wife works from home, so I'm actually very flexible at my site job as well. So they don't really, as long as I see my patients and get my work done, they don't really keep tabs on me. Kind of going back to the um, supervising physician role, so I'm able to leave. I go home for lunch most of the time if I can. I try to go home if I'm going to my other clinic. I'll try to leave a little bit earlier and go home and see her. And she will actually come with me to the other clinic, and we'll have like our workout stuff ready. And as soon as I get done there, we'll just go straight to the gym from there. But I try to make sure, we talk about all the time, that, you know, I am working a lot and planning on working a lot, but we also like to take trips too. So the good thing about my job now is I'm Monday through Thursday, and if I don't want to work Friday, Saturday, or Sunday, I just don't schedule it. And so if it comes a time we need a long weekend or something like that, then we're fortunate enough that we're able to do that. So yeah, we tell people all the time, you just have to make time. You know, we're big into fitness, so we work out 6 days a week. So that's one thing that we do together that we enjoy. But if we were still be at home together. Luckily, like I said, she's able to work from home, so she's not working long hours either. But you just have to find a way that works between you and your family and your significant other, and find what works, and make sure you make time. Make sure you make time for them. Yeah. emergency medicine people, have y'all like shadowed in the ER? Have you done that? Worked in the ER? It's a different ball game in there. It is. It's fun. It's transitioning from school to actual work. It was actually, they were really, really good when I first started working about kind of breaking me in slow and, making sure, even though I don't have a lot of oversight, but just making sure that, I feel comfortable. And so for me, it's been really, really easy. I mean, you do kind of hit a point where you're kind of like, you feel like you're thrown in the fire because all of a sudden now you are the one making the decisions. You are the one responsible. You're the ones that the nurses are calling, asking you questions on. You have to, you know what I mean? But you will be surprised once you get out of school and you start working, how much of that stuff you remember. And you're like, where'd that come from? Like, like you will remember so much more than you think you will. And obviously you're always learning every day on the job as well. But between your didactic and your clinicals, if you really put the effort into them, which if you get into school, you're going to, and pay attention on clinicals, you're going to be so surprised when you start working how much of it just kind of flows. You'll be really surprised. What did you enjoy most during your clinical rotations? I actually enjoyed surgery. I don't want to do it. I had a really, really awesome preceptor. He, he invited us to his, and I did my surgery rotation in like November. He invited my wife and I to his house for his Christmas party. He was super cool, and let me do a lot. So he was general surgery and trauma. And so he would call me. So we would do our typical lat choles and all that. And he would let me, well, our rotations are 5 weeks. Some of the med students only do they do 6 weeks, but they would only do 2 weeks with him. And he wouldn't let them do anything. Because he said, like, I'm not putting a scalpel in your hand until after 2 weeks. So after those 2 weeks, I got to do a lot. He taught me a lot as far as suturing. But it was really cool because I got to go in on some trauma cases. So a bunch of gunshot wounds, like hands deep in dudes' stomachs, and it was really cool, even though I don't want to be in the OR. So yeah, that was probably my favorite. And then the ER. I mean, it just cause it's just a different beast. You never know what you're gonna get. The ER kind of mimics with psych a little bit because you get a lot of that type as well. So one thing you miss most about PA school. I miss a lot about my PA school because I really enjoyed the school I was at. I enjoyed the faculty. And like I said, I feel like our class was really, really close, which was a benefit of only having a 30-seat class. And there were some super smart people in there. Like I said, we had 100% pass rate in our class. We had the highest overall GPA to come through the school into that point. And everybody just got along. So just, kind of, you kind of miss, I miss everything, you know what I mean? Like I miss the staff, I miss the people, and you kind of miss the grind a little bit just because that's how I operate. I was an athlete, so like that's all I know. That's why I work so much now, because I just that's how I operate. So I guess that's another reason I'm probably filling my schedule up, because PA school is like the gauntlet. They tell you it's like, that's the analogy they use of like the fire hydrant, and like you're just trying to catch what you can. It is like that. Have you thought about working with MLB players? I originally like, it's funny because before I got into PA school, I still had some connections from when I was playing pro ball, and I actually got contacted by the Astros to be a what do they call it? Basically, I was going to be in spring training and working with their rehab guys. So from hitting, but from also from like a medical standpoint too. So it's kind of like a liaison between the medical staff and the players. I actually turned it down because I was trying to get into PA school. Um, but the turnover in those type jobs is so high. Um, I'd rather have gotten to PA school and done that. There's just not many opportunities unless you're working with a team doctor who's happens to probably be ortho and doing some stuff like that. It's a little bit harder than you think to get into sports as a PA unless you're in with like an ortho group, and the Andrews group is here in Alabama, like James Andrews. If y'all are familiar with him, he's like the super ortho sports medicine guy for pro ball. But again, ortho just wasn't my thing. Um, Outpatient for sure, because I mean, obviously we went straight to telemedicine. So it did change in that sense. Inpatient, a little bit, because for a while, we would turning away or not admitting COVID positive patients, even if they were asymptomatic, to the inpatient unit because, everybody's in there together. And also what I've seen, the biggest impact from the psychiatric side for COVID is it has made psychiatric conditions worse from people being, as far as like depression and even psychosis, from not being able to see their providers, or just being at home all day with not much to do. And the other side is, like I mentioned before, being able to place like homeless people in some shelters and stuff like that. The shelters stopped taking people, so there was no place for people to go. And so if we were full, like, so I hate to say this, but some of the patients know what they need to say to get in, to have a place to stay for a little bit. It's just how it goes. I get it. But then at least we're able to send them out to shelters. But COVID shut the shelters down, so there was no place for these people that already didn't have any place to go, and so that was really, really, really bad. PA school that I attend, it's Mississippi College in Clinton, Mississippi. Yep. Yep, not big, but I liked it that way. Like I said, 30 class seats, really good professors. We had some really good. We had the former medical director for the entirety of the Mississippi Medical Center out there was on our staff. A couple of other really good physicians. I haven't. Not yet. I have seen it happen. And I saw it when I was in school in rotations. It has not personally happened to me yet. And that's fine. If they don't want to see me, then, well, I take that back. At my job in psychiatry, they don't have a choice. They don't get to dictate who they see. If they're assigned to me, I'm their provider. So, for the most part, I had my attending had me see a lady yesterday, but just simply because she had some psychosis, but she was like just adamant that she would not see him, wouldn't talk to him, wouldn't do anything. And so actually I saw one that they didn't want to see the attending physician. So it can go both ways, but I have seen that happen where people don't want to see me, and that's fine. That's fine with me. You know, I think a lot of times too, if you can somehow prove to them though that you're capable of taking care of them, that helps. I think a lot of times there's just a preconceived notion that, we're not as highly trained as we are, and that somehow we are, still a medical assistant or, and then it does kind of, the name does kind of steer people in the wrong direction at times. Like I don't care what I'm called. I don't care if I'm a physician assistant, associates, whatever you want to call it. But speaking from what I've seen, it can give people the wrong impression of our training and what we're capable of doing. And I think people are they don't know enough about the profession. They don't know how good the schooling is. They don't know how smart the people are. They don't know how good of providers they are. There's just not a lot of, because sometimes I've even had people ask me, what's a PA? And my response is, have you heard of a nurse practitioner? And everybody's like, yeah. I was like, okay, well, we're similar to that. We're just trained a little bit differently. They're like, oh, okay. So there's still, even though the profession's been around now for 50 plus years, there's still a lot of misinformation and just some ignorance about what it is we are and what we do. So, but if they don't want to see me, I'm fine with that. They don't have a choice right now, but in some of my other settings, if they don't want to see me, that's fine as well. What else? Keep them coming. Did everybody know they wanted to go to PA school? Did anybody want to go to like med school or something else? And then kind of like I did, kind of fell into PA and was like, oh, this is awesome. I'm trying to when I interviewed at Mississippi College, I was not asked that. But I'm trying to, when I interviewed at Medical College of Georgia, I'm trying to remember if I was asked that. And I'm pretty sure I might have been. I did say age for one thing, but I made it clear that it wasn't just my age, that it was the laterality that you have. I made it clear that it was my choice, not just for financial or my age reasons, that I wanted to go to PA school. Even though the age played a little bit of part in it, I didn't let on too much to that. I made it clear that I learned about the PA profession and I described like all the reasons I liked it over going to medical school. On the legal and legislative side of the PA profession, how do PAs represent themselves on how we practice medicine? Not exactly sure. I will say this. PAs are the PAs I know are very proud to be PAs. No PA I know second guessed going to PA school. And I have found that it's almost, that's why I said, to me, I don't mind being called mid-level. To me, that doesn't, That doesn't degrade any nurses. They're not a low level. They just don't have to, their skills are sometimes just as good as ours, sometimes better. They're probably better at some procedural stuff than I am. In fact, I know they are. But in the hierarchy of the system, they don't have to answer to the things that we have to do or make the decisions that we have to. In the same sense, we don't, as PAs, don't have to answer quite as high or make decisions that the attending physicians do. So I like being in the middle, and I think most PAs do too, although I think sometimes as a profession, we, even the AAPA, might want to overstep our bounds just a little bit. And I get it. That's because, just what I said before, people don't know what we do or what we're capable of. But I'm a firm believer that we do have limits. And if we weren't okay with those limits, then we should have went to medical school, and then you wouldn't have had any. You know, going into the PA profession, that we are advanced practice providers. We're mid-levels. There are some restrictions. We have we have supervising physicians that we have to have. You know that going in, okay? So I know there's a lot of legal push for the PAs to be able to do more, and I'm all about it. If a nurse practitioner can go open up a clinic, I don't know why a PA can't. That makes no sense to me. I sat in a classroom for almost 3 years with a crash course medical school, and nothing against MPs. Some awesome MPs. The dude, one of my friends that was my preceptor in the ER, the dude is the smartest dude I know as an MP, could go to med school right now. But, and he will even tell you that he prefers PAs just simply because of the training that we have. So there's a lot of on the legal side stuff that, yeah, we need to fix state to state, but we also need to keep in mind, you know, what we are and what we do. Yep, sure. I'm not sure if that answered your question about the legal and legislative side. If not, let me know.
While we're just sitting and then they can answer, I just wanted to go over really quickly. Am I echoing for you guys? Okay. Just how the certification will work. So basically, I'm going to send a link to a Google form, and all you have to do is fill out your name, your email, and how you heard about ISPR. And we're going to send you an email with a certificate for attending the live shadowing session today. So if you guys have any other questions, please put them in the chat. And if you missed something from the day and you want to go back and see it, it will be up on our YouTube channel later. And feel free to check out our other sessions. And thank you once again so much for joining us, all of you, and you, Dr. Torbert. So thank you, everybody.
Yeah, awesome. I think it's really awesome what y'all are doing. It's really awesome that y'all tuned in for this. You're doing the right thing. Keep working at it. You will get in if PA is what you want to do, and you will all be awesome. How did I get into aesthetics? It kind of fell into it. My wife wanted me to do it, and then fortunately at the clinic I go to after hours on Fridays, they actually approached me and said, would you be interested in doing this? And we'll send you for training. And I'm like, absolutely. I'm never going to turn down a chance to learn something. And I think it'll be good. I don't think there's enough dudes out there doing it. So I think there'll be I don't know how big, but I think there's some clientele out there for some people that would want a guy to do some aesthetics on them. Like I said, if not, at least I got some training on it and can do it at some point. So, yeah. No problem. Thank y'all for having me.
I think if that's okay with you, we'll have that be the last question, and just then we can be done within an hour. And that sounds good to me, if that sounds good to you.
Perfect.
Awesome.
Thank
Once again,
you.
thank you.
Good
Yeah.
luck to everyone. Keep working hard. You'll get there. Promise.
Awesome. Thank you so much. We loved
You're
hearing
welcome.
from you.
No problem.
Thank you.
You're welcome.
Good luck.
Thank you. Good luck to you, everyone.
If you guys don't have any last questions, I think we're going to end the Zoom call so we can end the YouTube stream. I can send the